Okay, hello everyone. Good morning. Welcome to third Hexham debates of 2026, we think. Thank you all for coming on a lovely sunny day. We're delighted to have Alice Wiseman back for what we think is at least the third time that she's come and spoken to us, which we're really grateful for. So Alice has been Director of Public Health in Gateshead and Newcastle since April 2024, and before that was Director of Public Health for Gateshead. Before that, she worked in a range of senior public health roles across Tyne and Wear, degree in social policy, postgraduate study in education and training in public health. Do you want me to say a bit more about structure of debate before I carry on with the introduction? Or I'll give you a bit more of an introduction for Alice. I'll then hand over to Alice, and she's going to share her talk with us today about food insecurity. If you have any questions while Alice is presenting, if you can pop them into chat and we'll kind of summarize those at the end and we'll hopefully have time to get through those. We're recording the presentation, as you can see. So if you don't want to be on that, if you make sure your camera's turned off, and that recording will be available soon on Hexham TV. The Hexham debates are free, and we always appreciate any donations to keep them going. So I think the bank details for making those donations should also be in the chat box, but we'll share those again at the end. As you'll have heard from, if you've been at previous debates where Alice has spoken, she's passionate about improving health and well-being, and particularly about focusing on inequalities that are faced in our communities. Particularly this idea that you can have two babies born on the same day, the same hospital, and they can have such different life chances, depending completely on the circumstances into which they're born. And her approach is firmly rooted in the belief that it's people in those communities who have lived experience of them that are the ones who can kind of share the most and need to be completely central to identifying and solving those issues of inequality. So looking at what those barriers are and finding ways to improve outcomes. Alice is also involved in co-production and production of research evidence, looking at health determinants, a lot of that being informed by the Marmot Review, which was back in 2010, looking at fair society and healthy lives. And again, the research is looking at how to give a voice to people who are marginalised and least likely to be heard in society. Alice is also Vice President for the Association of Directors of Public Health and the Policy Lead for Addictions, which involves working closely with national colleagues, giving evidence to all party parliamentary groups and a parliamentary committee. So last year, Alice spoke to us about the vision for Newcastle, especially of how the whole city was kind of responsible for caring for children in the city. And that was part of her public health report for Newcastle for last year. And I believe today she's going to be talking to us about the focus of this year's report, which I think builds on that because it's looking at how important affordable, nutritious food is in all of those health determinants. And that's something that obviously really affects a lot of families and children, especially across the city. So I'm going to hand over to Alice to share that with us and hopefully get the screen shared as well. So I'll let Pete do that. But as I said, if everyone can make sure you turn your microphone off, and if you've got any questions, if you can share them in the chat, that's great. If you're not able to do that, if we wait till the end, and then I'll see if anyone has any that they want to ask.
Great. I'll try and share my slides and you can let me know if it doesn't work as well as it should.
Brilliant, thank you. Oh, so there we go.
Can you see that?
Yeah, it's coming up just as like the full, yep, there you go, that's brilliant.
Perfect. Okay, thank you very much. That's a really nice introduction, and thank you for inviting me back to have a chat with you today around some of the work we've been doing around food insecurity in Newcastle. This is my second annual report for Newcastle. The annual report from the Director of Public Health is a statutory duty, so we have to produce an annual report every year. It's not party political, it absolutely has to be independent of party politics, but it allows me an independent opportunity to set out the things that I feel are of concern that need raising and flagging within Newcastle. So Grace was just talking last year, we focused on it takes a city to raise a child. And actually, through some of the work that we've been doing, we were looking at the impact of food and food insecurity. So I'll just start by asking you a question. How many have been asked this week, or indeed have asked yourself, what's for tea? It was definitely a regular question in my household, both while I was growing up and also when I was raising my children. And I always had an answer. It never crossed my mind that I wouldn't. But sadly, we know this is not the same for all of our residents. In 2024, nearly 1 in 4 households in the Northeast were facing food insecurity. And when I'm talking about food insecurity, it's not just about hunger. In the UK, healthy food is at least twice as expensive as unhealthy food, calorie by calorie. And the food and drink we consume affects our oral health, and tooth decay is the most common reason for children to attend hospital in England. People experiencing food insecurity also tell us that they experience incredible stigma and shame, which can create barriers to seeking help. And this all combines to negatively affect mental health, leading to anxiety, depression, cognitive decline, and social isolation. So as Grace mentioned, I've done a lot of work with Sir Michael Marmot over the years, and he uses a quote which always resonates with me. Why do we continue to treat people and send them back to the conditions that made them sick? So this slide describes our profile if Newcastle were a city of 100 people. Just to give you an idea, there would be 17 of those 100 under the age of 16 years. 68 of them would be aged between 16 and 64, so largely of working age, and 15 of them would be aged over 65. 4 would be Asian or Asian British, 6 would be Black or Black Caribbean or African, 4 would be mixed or multiple ethnicities, and 71 would be white. There would almost be half and half, with 49 males and 51 females. And while English is the main language, there were at least another 27 other languages across the city that were identified. Almost 2 in 5 of residents in Newcastle live in the 20% most deprived parts of England. In Newcastle, men live an average of 77 years, with just over 18 years lived in ill health. And women live an average of 82 years, with 22 years living in ill health. This infographic tells our story of food insecurity and the potential impacts that food insecurity has across the life course, starting with low birth weight, tooth decay, free school meals, childhood obesity, school readiness, unemployment due to long-term sickness, issues with transport, fuel poverty, isolation, anxiety, diabetes, and cardiovascular disease. Food insecurity, however, is not a binary issue. There is a spectrum ranging from those who are fortunate enough to be food secure through mild insecurity into moderate and finally severe insecurity. Mild insecurity may include careful budgeting and substituting meals for snacks, leading to stress, worry, embarrassment, and guilt. Moderate includes the need to compromise on the quality and variety of food. As mentioned already, healthy food is at least twice as expensive as unhealthy food. This affects people with low incomes, and we know that obesity rates, as a result, are higher in areas which experience moderate food insecurity. This group are also affected by reduced immunity, possible depression, poor sleep, an adverse impact on child development, shame, guilt, and stigma. And finally, severe food insecurity. This can lead to social withdrawal, changes in appearance, an association of anxiety rather than pleasure around food, obesity or malnutrition, chronic stress, dental decay, and amongst many other poor outcomes. As I've already said, drinking and eating sugary foods can cause tooth decay and gum disease, which can cause pain, tooth loss, problems with our hearts, and also diabetes. Between 2021 and 2024, 370 children under 5 were admitted to hospital in Newcastle for tooth decay, and a quarter of our 5-year-olds had visible signs of dental decay. I've also already highlighted how weight can be affected by food security, with healthy weight being more expensive. Stigma is also closely associated with being overweight, as many people assume it's purely an individual choice. Poverty, alongside the commercial drivers on much more significant issues. I always say it is not possible that a whole generation of people have lost willpower at the same time. In this context, if weight management services are viewed as the only solution, this could contribute to a growth in inequalities by asking our poorest communities to adopt a diet that is just not affordable. Michael Marmot highlights if the poorest 10% of families were to follow the healthy eating guidelines, they would spend 3/4 of their income on food. The relationship between food and mental well-being is also complex, with social, emotional, and physiological changes. When access to food is limited, this can lead to loneliness, experiences of shame and stigma, nutrient deficiencies, which can lead to changes and challenges in learning, remembering, and reasoning. Malnourishment leads to difficulties with problem solving and emotional regulation, and all of this contributes to feelings of anxiety and depression. Stigma also harms communities by creating social barriers that lead to isolation, late or crisis interventions, poor health outcomes, and growing inequalities. Inequalities are bad for everybody, regardless of your position in society. In society where there are greater levels of inequality, you have lower levels of community cohesion, poorer child well-being, and less acceptance of that need for reciprocity within our communities. One resident in Newcastle described the shame that she felt when she first contacted a food bank after losing her job. She said she parked around the corner, avoided contact, and worried that people would judge her. Over time, spending time at the hub helped her meet others in very similar situations, and she later began volunteering and helping others as she had been helped. She told us, "They didn't just give me food, they gave me respect." His story demonstrates how supportive, non-judgmental spaces can rebuild confidence and restore dignity. Last year, if you were here, I spoke a bit about the commercial determinants of health and particularly focused on the impact it has on our children and young people and the world that they're growing up in. It's a really fundamental element of this particular issue as well. There are a handful of industries that use specific tactics to increase their profits, which ultimately undermine health. This includes the way that food is produced and promoted, ultra-processed food, which has a focus on quantity and cheap prices rather than nutrition. Aggressive targeting and marketing of these products, which distort social and cultural norms. Industry-funded research, which aims to cast doubt over scientific evidence. Lobbying political parties to influence national policy, and lobbying for self-regulation, which we all know has been evidenced so many times to be largely ineffective. So this sounds like there are loads of challenges, and I don't want to take this completely negatively because I'm sure, as you would expect, we're not taking this lying down, and there's lots that we are already doing. Newcastle Food Bank, commissioned by Public Health to host Food Newcastle, which aims to connect community voluntary sector partners with public services, the local food economy, and communities in order to build an equitable, sustainable, and delicious food culture. We have a food system strategic group which leads the council's action on food, and this sits alongside the food security working group, which coordinates the efforts across the council. And the food in schools working group, which focuses on both the quality of meals in schools as well as take-up of free school meals. We host a holiday activities and food programme, which has been providing meals alongside positive activities for children and young people during the school holidays. And we've already signed a Healthy Weight Declaration, which commits us to system-level change, focusing on the food environment and commercial influences. There are many, many spaces and places that operate across Newcastle to support people with food security. This slide just shows just some of those that we know about. Community cafes, community gardens, the Men's Pie Club, Food Justice West End Women and Girls, Food Cycle, St Vincent's, Nourish Food School, Family Hubs, Meals at Home. I could go on. The West End Women and Girls Centre run a food justice programme, and through weekly sessions, women and girls from different cultures grow, harvest and cook together, using food as a shared language to rebuild and build new friendships. The Men's Pie Club started in Byker in 2017 and it now has a further 5 clubs operating across the city, with 34 operating across the northeast. The aim is to get local men together in a relaxed, supportive space where they can connect over good food and company. Our family hubs serve as an initial contact point, offering holistic support and pathways into our food security infrastructure, such as our Fair Share programme and partners and our local pantries. Within Newcastle Food Bank, we also have a Pathways Out of Hunger welfare service, which offers support with income maximisation, debt, housing advice, and links to employability pathways. Food pantries and social supermarkets offer a community-based retail model with reduced prices, often 70% cheaper. They are designed to promote dignity and choice alongside community support. We must not forget as well that food is important for climate resilience and health equity. The food system, how it is grown, how it gets to us, how far it travels, all impact on the sustainability of the planet. Sustainability and health outcomes can be improved by reducing food waste, promoting seasonal and local growing and eating. Fuel poverty and food insecurity often coexist, driven by low income, poor housing, and rising fuel costs. We know that 14,000 residents experienced fuel poverty in 2023, which limits access to heating, lighting, cooking, and the appliances that we probably use on a daily basis. Again, there is lots we are doing. Our energy advice team helps people focusing on the affordability of energy, housing efficiencies, and income maximisation. Our school meals service was awarded the ProVeg Bronze Award in both 24 and 25. ProVeg UK is a food awareness organisation working to transform the food system by replacing 50% of animal products with plant-based and cultivated foods by 2040. We achieved the award by introducing one meat-free day each week, alongside much better descriptions of plant-based food and also seasonal changes to our menus. As you've already seen, there are many voluntary and community sector organisations that are working across the city to support individuals with growing food, learning to cook, and access to those extra food parcels. In recognition of this important role that our VCSE partners play in food security, we've funded 120 kilograms of good-to-eat food through our Fair Share partners. In the first 6 months, more than 130 tonnes of food were saved from being wasted. And finally, food waste collections were trialled in over 5,000 households, with the waste that was collected being used to create new bioenergy and trying to help the city to become less reliant on gas and electricity. So just to finish, the recommendations that I provided to the council and to our partners from my report aim to build on the foundation of the work that we are already doing. We're working currently as a city to become what's called a marmot city, making sure that we focus our attention on tackling those really unfair inequalities. So ensuring that we recognise that food security is a priority for all of our residents as we take that work forward. We need to make sure that we listen to those who've experienced food insecurity, so our response is based on dignity and enabling people to have a sense of control. Our approach needs to take account of the amazing work that we're already doing, but it also ensuring that provision is culturally sensitive and also sustainable. We need more action to build the knowledge and understanding of the link between food insecurity, fuel poverty, and excess weight. We need to continue to build capacity for early intervention and prevention through strengthening our local food system, developing connection between local growers, distributors, retailers, and community organisations to improve the supply chain, support local economies, and ensure a more equitable access to healthy food. We need to strengthen our data monitoring and use of relevant indicators to align food security and action and progress with population health, poverty, housing, the local economy, environmental sustainability, regulatory services and planning. And finally, we need to make sure that we continue to develop our local evidence base to guide our understanding of the impact that our existing approaches and support programs have, to ensure that we can make sure that they are improved and targeted in the right way, as well as being able to influence national efforts to restore health equity to our food system. As part of this work, you may have heard of Dr. Chris Van Tullochen, who does a lot of work in this space. And we asked him for his thoughts on the challenges that we face across our city, but also the work that we're doing. And I'll just leave you with this quote of what he told us.
Brilliant. Am I unmuted? Yeah. Thank you so much, Alice, for sharing all of that. And I think, as Andy said in the chat, that you're doing so much. It's all the stuff that's happening in Newcastle sounds amazing. So we've got a question from Andy, and then I've got a one as well. So if anyone else has any questions, if you have a think about anything you might want to ask. Andy said you're doing so much, which is great, but how worried are you that the Iran war will lead to a new period of recession with all of its implications?
Yeah. I mean, it's every time we have an international crisis, it has an impact. So it's the Iran war now, but if you think of what our communities have experienced over the last 15 years with austerity, welfare reform, the COVID-19 pandemic, the cost of living crisis, we know the impact that the war in Ukraine had on. So each time we have that, whilst it may feel like it's a long way off, there is absolute concern. And we know the people who are impacted greatest are those who have the lowest levels of income, the lowest levels of resilience, being able to respond to it. So we are very, I would say steadily, but it's not even steadily, seeing an increase in demand for all of our services. What we're trying to do at the moment is trying to sort of think about actually providing that crisis response to those most in need, but embed things like welfare advice within those provisions. So you might be responding to a crisis, but you're also giving people the opportunity to think about longer term resilience, making sure that people are accessing all of the benefits that they're entitled to, for example, or maybe helping them to manage debt so that they can sort of come out of that situation. So not just thinking about that crisis, but actually how we also connect that with that response. But I am worried about this and all of the other things that have happened. I think that our communities at the moment have experienced a real sort of more than a decade now of real challenges. And we are seeing that in our health and care services. We're seeing that in the increase of the number of people who are presenting for services, whether it's mental health services or physical health services. So it's always a worry, and anything that always impacts on those who are most disadvantaged to a much greater extent than those who've got that kind of resilience to be able to buffer some of the challenges that we see.
So it's kind of building that community resilience so that groups aren't as dependent on those fluctuations that you've got. If people are in a better situation generally, then it helps to provide some of that resilience that they've already had that welfare advice and all of that. The other question was, I think it was in relation to the ward map. Which ward is the dark blue one?
Yeah, so that's the east of Newcastle is where our most disadvantaged places are. It's also where our children and young people are. So it's sort of biker, walker, it's that area along the riverside that we see significant challenges. And like I say, that's often where you see the most levels of disadvantage regardless of which lens you look through.
And there's a lot of amazing projects quite recently have started there. I think in Biker they've got a new community centre.
Yes,
the one in I can't remember the name of it, but in the church.
And they've got a new facility as well linked around the community and voluntary sector to bring them together as well in one place, to give them, because I think that we recognise that nobody's got lots of money, but actually how can we use the resources that we've got currently to give those partners who really are deep rooted in our communities that need us most that kind of ability and space to be able to continue the amazing work that they do, and they do amazing work.
Yeah, and we just had a note there that Biker also has green representation on the council. So I think there's also quite a lot shared of kind of community. I know I've seen like examples of litter picking and things like that, but I think also of the kind of stuff around community gardens. It's always a positive to have that in terms of, like you were saying, the prevention as well. That it has such a benefit of bringing people together that then also improves those health outcomes. I think I did some like a community centre that was there, and they had the Magic Hat Cafe, and they used to have people coming in and cooking the meals, and that it has those kind of, not necessarily the main impact, which is getting people fed, but it also has such a positive
Well, and it's more
impact.
dignified, isn't it? Because you don't have to go to somewhere and say, I'm hungry. You're going there to have social connection, to have friendships. And actually, that's as important. And if you look at all of the projects that you can see that are running across the city, and like you say, there's loads going on. We can't take the credit for many of them. You know, lots of them are being ran by community organizations themselves. But it's that bit around, it's more than just food. It is about social connection and that opportunity to think about like how we connect as humans, which I think, you know, because in areas where there's greater levels of inequality, you often end up with lower levels of community cohesion, which is the stuff that you start to see where people start to fight to have their needs met because there's no reciprocity. And I mean, that's highlighted if you look across the world, and the places in the world that have the greatest levels of inequality, they've got barbed wire around their houses, and, you know, they've got weapons to defend themselves, you know, there's an absolute correlation between growing inequalities and growing levels of antisocial behaviour and crime, you know. So actually doing some of this about bringing communities together is so much more powerful, and that opportunity for people to help each other in a way that is just human has so many knock-on impacts, as well as, like you say, making sure that nobody's hungry.
And I think kind of in contrast to that, David's asked if that's the kind, I guess that's the kind of protective factor, isn't it? Having people having a cohesive community where they're working together to make sure that everyone's fed healthily. And then to counter that, you've got David's asking how much can local authorities take action against the kind of pernicious acts of big food. So as an example, he's asking about whether there's restrictions on public advertising, highest business rates for businesses that do not seek to compensate for those social harms.
So there is stuff we can do at a local level, but there is also our role in advocacy. So in the last 12 months, I've gone to Parliament twice now, and I've given evidence to select committees around the impact of the commercial drivers of ill health, you know, whether that be through, you know, sort of ultra processed food marketing, whether that is alcohol, whether that is gambling. You know, I think we've got a lot we can learn through tobacco. We talked a bit about that, didn't we, last year as well, or maybe the year before. But it was that whole bit around, we know the things that have made the greatest difference in terms of tobacco, and actually they're the regulatory things that happen at a national level. Interestingly, they are the cheapest public health intervention and the most value for money in terms of amount of money back in the public purse. So for every £1 you spend on national regulatory, you get £43 back to the public purse. Whereas at a local level, kind of public health interventions are still very value for money, but it's £1 to every £14 back. So I've got a role around advocacy, and, you know, because I've got a level of independence in the Director of Public Health role, it means that I am able to go and speak to Parliament around the things that I'm concerned about for residents in Newcastle and in Gateshead. And certainly I continue to do that. At a local level, there have been a number of things that have happened. So I'll talk about one which we did in Gateshead. So in Gateshead in 2015, we did nutritional analysis of all of the hot food takeaways, and you would be unsurprised to hear that they were all incredibly unhealthy. So I always remember that pepperoni pizza had 3 days worth of recommended daily allowance of fat for a woman in one pizza. You know, so we identified that the food was unhealthy. And that was important as much as it was obvious, because we need to be able to evidence the decisions we're making. So we then did a piece of work with our planning colleagues where we said, actually, in a ward where there's more than 10% childhood obesity, no new hot food takeaways will be approved. So in Gateshead, we've not had a hot food takeaway approved since 2015. So we're now coming up to 11 years with no hot food. Now, we already knew that there were too many, and to some extent, it could have been seen like closing the stable door after the horse has bolted. But actually, what we have seen over that time is a reduction in hot food takeaways in Gateshead. Because as you change planning permission back, you can't change it back to being a hot food takeaway again. So if one closes and it just reopens as a hot food takeaway, there's nothing we can do. But if one closes and becomes a shop, then they can't turn it back. So we have seen a reduction. And there was some research out from Lancaster Uni that was published before Christmas this year, I think, which I had identified. They'd done some analysis looking at data for Gateshead and compared Gateshead to another area of the Northeast that hadn't got this policy. And they were able to point to a reduction in childhood obesity in our most disadvantaged places as a result of having that policy in intervention. Now, there's loads more we can do because they always find ways around it. McDonald's are classed as restaurants, so they're not included as an eight in terms of the same planning laws and all the rest of it. So we often end up stuck in that place. And but interestingly, on that one, Kentucky Fried Chicken challenged the council on it tried to take us to court to say that our planning policy wasn't, and that's what they do because they've got so much more resources than we have. And we were really fortunate that actually they backed our policy decision in Gateshead, and so it's remained. But when I raised that at Parliament recently, Kentucky Fried Chicken denied ever challenging us as a council, and I'm able to provide the evidence that they did because I wouldn't say it otherwise. But that's the kind of challenges you've got. There are other places, and we're certainly looking at this for Newcastle and Gateshead at the minute, where they've looked at restricting advertising for ultra processed food. So the best example is on the London Transport for London system, where they've had this in place for a number of years. And what they've seen is there's been a reduction in calories of around 1,000 per family. So that might not seem huge, but it's quite significant for those people who are using that transport system. I know that Kim McGuinness, as the mayor, is looking at that for the areas that she has responsibility for across the city, which is the public transport system. But at a local level, we can do the same thing. So we can look at anything that's owned by council and is on council land, then we can have an influence around what advertising and promotions are there. So that's definitely kind of our next step, if you like, in terms of thinking about the work. So it's a match of what we can do to advocate for what we need nationally and also the work that we need to do locally.
Brilliant. I think there was a question there about whether it's possible to do that in Newcastle, the issue with the planning and the hot food outlets.
So that has happened in Newcastle now. So actually, I can't take the credit for it because it was as I started in Newcastle that planning. So they did some work in 2016 in Newcastle. Other parts of the country have done the same, where they've looked at areas where children congregate, and they've said no planning applications 400 or 800 metres around a school or a community centre or park. And Newcastle had already done that in 2016. Okay. But in 2024, they increased it so that it was the same as Gateshead's, in that it was nowhere unless if there's 10% childhood obesity, and we have really good data on that because we weigh and measure all of our kids in reception in year 6. Then you can't have a new planning application. The only exception for the city is the city bit, because of the sort of impact in terms of the shops and the spaces there. But that's the only exclusion across the whole of the city. And actually the evidence around exposure is about exposure where you live and exposure when you're moving between work and home or school and home. So that is there in Newcastle now. But
brilliant. And I think kind of linked to that, Jim's asked about relating to other authorities. So how advanced are other local authorities regarding this challenge? And this was something I was thinking about as well. What about rural areas, and whether you think, almost looking at what you've done in Gateshead, whether that's something that, and for Newcastle, whether that can be applied to areas in Northumberland, whether you sort of had advice on how that would work or what the barriers might be doing it in a more kind of dispersed population.
Yeah. So Jill O'Neill's the Director of Public Health for Northumberland, and she's amazing. She's just published her annual report, which I haven't read yet, but you all might want to have a look for it. And she's looked at rural health. So if that's a particular issue, that looks like it. I haven't read it myself yet. It just came out this week, but I think it looks like a good read. But certainly I know that she's in that space, in terms of thinking about particularly the more disadvantaged places. And it is different in some respects, because you'll have different levels of, childhood obesity and the different distributions across the rural area. But I know Jill is always kind of looking at what is harming the communities and where she needs to focus her attention. I don't know the detail of it for Northumberland though. I do know that, like I said, there are other places in the country that have done this, because there's a question there about other local authorities as well. So I know lots of people have done the work around hot food takeaways. Some people have done 400, 800 metres around a school, like I say, and then others have gone a bit further, like we have. There is a national review of the National Planning Policy Framework, and we're just really hopeful that they're trying to strengthen the health component of planning. Because if you think about where planning actually originated, it originated from, the need to kind of get rid of the slums and, all of the issues that we had, like 100 years ago. And the reason they did that was because there was so much illness. And the illness then was obviously infectious diseases. Now, thankfully, we don't have that, but we need to use planning to help shape the issues that we've got today, which is much more about those things. So they are looking nationally at how they strengthen that and make sure that that's included in there. So it isn't a postcode lottery, if you like, depending on which areas have done the work and which haven't. I mean, Sheffield's done some amazing work around banning advertising of all sorts of unhealthy commodities. So they've included energy drinks, ultra processed food, alcohol, gambling. They've really sort of extensive, and I think that the impact of that is really amazing.
Brilliant. There's a couple of questions I'm going to ask them in not the order they came in, just because. So I've got a question from Nick, which is looking at that relationship with UK government. So are you able, with all your experience and knowledge, to have an influence on the UK government to address UK food insecurity? So I think that's about the work that you're doing with those parliamentary groups and how much influence you can have there.
So we can advise. We are not the decision makers, and that's always the challenge. And I think what I worry about is that sometimes we advise, and you'll see from my slide on the commercial determinants of health that often the industry gets in and advises government in a different way. They always run the fear of it'll impact on the economy, when the evidence doesn't bear that out. Sort of actually the evidence does not support that at all. And I'll give you an example of that, which is an alcohol example, actually, rather than food. But still, if you think about the amount of calories that there are in alcohol and no nutritional content whatsoever. So we know in Scotland and Wales and Ireland, they've got minimum unit price, which is really a measure that impacts on those really high strength, cheap products. But the alcohol industry have kind of created this narrative that, it's affecting the pubs. And, it's not affecting the pubs. Pubs don't sell below the minimum unit price anyway. So, and we've seen the impact from Scotland, for example, in terms of the reduction in the number of people who are accessing emergency admissions for alcohol related harm, not just for addiction, but I'm thinking about, sort of some of the cancers, 7 types of cancer that's caused by alcohol, all of that. That's actually, there's a 27 billion pounds we spend every year as a country tackling alcohol related harm. We don't get the money back in terms of the money that we get in tax from the alcohol industry. But in the lead up to the publication of the NHS 10-year plan, we'd heard that there was a possibility that minimum unit price would be considered as something for England, which obviously we were really excited about, because we've seen the impact that it's had on reducing illness and death elsewhere. And then when it was published, it wasn't there. And we were all a bit surprised, because we'd been given really good indication that it was going to be there. And so the Institute of Alcohol Studies, which I'll declare a conflict of interest, I am a trustee for the Institute of Alcohol Studies in my spare time. But they did a freedom of information request to say how much lobbying was there done by the alcohol industry in the lead up to the publication of the NHS 10-year plan. And they published a report before Christmas, which showed the scale of the, sort of challenge. And they were suggesting that we were going to kill, hospitality in pubs. And, like I say, there's a whole load of evidence in that report, if you're interested in it, which shows that, actually the issue that we've got is that more people are drinking excessively at home. It's not a reduction in the amount of alcohol that's consumed. It's the fact that people are drinking at home and people are drinking cheap supermarket prices. That's what's affecting hospitality, not the minimum unit price. So there's a whole load of ways that industry, and they're just so much richer than we are. They've got more money. They've got, more opportunity to spend time lobbying and, sort of making donations or producing their own research, which undermines the scientific evidence. And that's the challenge we've got, is that it's David and Goliath. We're kind of up against these really big multinational corporations, but we will continue fighting, because I always think in 1962, when the Royal College of Physicians report was first published, identifying the link between smoking and cancer, everybody said, don't take our cigarettes away, that we like that. That's part of what we do. That's part of our culture. And actually over many, many decades, we've managed to do things so that people actually are much better able to make an informed decision around what they're doing. And we know that many people aren't choosing to smoke as a result of that. So that I always think my public health predecessors must have felt really disheartened in the 60s when they were faced with that sort of challenge. I feel like that's what we're facing now around food and alcohol and gambling. And actually, we just have to keep going and keep advocating for what's needed. People before profit.
David's asked, with regard, I guess, to getting I suppose getting money into councils, but also preventing there being those high fat, salt, sugar outlets. If high CO2 vehicles have to pay a higher road tax, why don't those outlets have to pay higher business rates?
I think that's a really good suggestion. Like, I mean, and like, you know, they're the sorts of things that we can look at. And I don't know how much or autonomy we have at a local level to do that. But, you know, certainly that would make absolute sense. I mean, I guess that what we would need to do is think about how we define that. That was the difficulty with hot food takeaways, because we know, for example, there are certain shops that people buy their lunch from that probably aren't particularly healthy, but they are classed as shops as opposed to hot food takeaways. And so getting the right definition, and like I say, that's why we did the nutritional content analysis, so that we could actually say, no, this is definitely unhealthy food. But, you know, I think that would be a great idea. I shall take that one back.
Brilliant, thank you. I'm just trying to get through to some other questions on the, see if I can, right. Where am I? Oh, there we go. So that was another one looking at, so we talked about, issues in other authorities and rural areas. Got a question from Andy that most of us want the government to do more. How important do you think lifting the two-child benefit cap will be to families in the Northeast? I guess in terms of, specifically in terms of kind of health outcomes.
Yeah, well, I mean, I think it'll be really significant. You know, sort of, you know, we know that children who live in, you know, large families are much more likely to be living in extreme poverty. Interestingly, it was a particular issue so in Gateshead, we have a really large Orthodox Jewish community that have large families, and, you know, they're not necessarily a particularly wealthy community. And, you know, so certainly I've had many conversations with them around the impact that that's had on their ability to make those choices. There's loads of evidence which shows the number of families that will be lifted out of poverty, or at least lifted a bit further out of poverty as a result of that. I tend, because I'm politically restricted to some extent, I tend to stay out of kind of what the solution, like a policy decision, might be. But actually, there is evidence that sits behind that, which means that I'm able to say that would have a difference, definitely.
Brilliant, thank you. I think there's a question from Jim is, look, you're talking about the food being provided in schools, and that was something that I think you said the research had been done on that in Gateshead. So it was a question. I think you said that there'd been interventions around the plant-based food, especially. So Jim's asking,
Yes,
do local
yes.
authorities, do they research the quality of food that's being provided in schools and care homes?
So it's different in different places. So in Newcastle and Gateshead, the council is the main provider of food in schools. So we have much greater influence over what that menu looks like, and the nutrient content of the food and the offer. You will know that many schools have become academies over the last few years, which gives them a level of independence. They don't have to buy back the school meal service from the council if they don't want to. And some areas have stopped providing a school meal service from the council because we often have to put quite a significant subsidy into it. So it's like over £1 million of council money subsidises the food that goes into our schools, you know, to enable us to actually have conversations around the type and quality of the food that's provided. And from a care home perspective, you know, there are links with adult social care and also health that go in and provide support into care homes. But I'm not as familiar with the detail in terms of the work they've done around healthy food. What I do know is that we do work with our hospitals, but we acknowledge there's quite a bit more that we need to do there, you know, because we know that good quality food actually helps people, you know, to thrive. With elderly people in care homes, we know that there's a real issue around the types of food that people are provided with and whether they're, you know, cognitive decline, for example. So, you know, it's definitely a space that we're getting more into. And certainly when I took this report to the Health and Wellbeing Board in Newcastle, that was the question and the challenge that we had. You know, not only are we influencing the things that are happening out in our communities, but what about the spaces and places that we are responsible for? And our hospitals are not always the healthiest food environment, you know, and we did a piece of work on that across the region where we actually did a bit of work to map the types of food offer that there is in hospitals. And, you know, it's always this challenge where the places pay for space in hospitals, so there's a bit of income back to the hospital, but actually the impact is unhealthy food.
I mean, in terms of I guess in terms of not so much getting the message out there, because you've spoken about how it sounds like what you're saying is that the focus really needs to be on at that larger level, because telling people you need to have self-control, it doesn't make sense, because that's not
It
what's
doesn't
causing
work.
it, and it's no.
It doesn't work. Like, so, and I'm quite controversial when I say this, because like so you've got this massive investment over the country now in terms of weight loss drugs. We know that people will lose a bit of weight, and I'm sure everybody on this call probably knows somebody who's bought them themselves and have lost a bit of weight as a result of it. We know that they tend to put weight back on faster as soon as they stop using it. And we also know that there are potentially some harmful side effects, such as issues around bone density. The issue, again, you've got is a commercial determinant of health, because actually what the pharmaceutical company in this context did was they worked with government to go through the first stage of testing of these drugs. The government then permitted them to be provided. And once they are permitted to be provided through NICE, the NHS has to respond and has to provide the drugs, like even if they don't necessarily think it's the best thing to do. And then they stopped doing the rest of the testing because they were already on the NICE formulation category space. So, it's a real challenge. And people will often say, but it's so easy and you can eat healthier foods. And you can, but it is calorie per calorie. And I'm saying it very deliberately. It's twice as expensive to eat at least twice as expensive. Other places have estimated 3 times as expensive, but I'll go with twice just so it's realistic. And actually what we're asking our families to do, and some of the families that we work with may not even have tin openers, may not be able to switch their oven on or their grill on, may not be able to boil their kettle because they haven't got electricity. So we are doing bits of work around, things like provision of slow cookers and stuff that are probably a bit more, sort of cost effective in terms of energy use and stuff. But actually, the reality is that telling people to eat healthy food, people lose weight and then they put it back on again.
And how
but
do
I
you think?
I genuinely think it's our environment.
Brilliant. And how do you think that schools can help with, I guess, with helping with children having better nutrition, or in terms of those messages that are getting out of maybe challenging some of the pressure that children are going to be under from those kind of corporate messages
So
around food?
in our report last year, if you remember, we'd asked children and young people what a healthy, positive environment looked like for them, and actually they'd named these big corporations as part of their view. That we have to protect children from that influence in the same way that we've protected children from the industry influence around tobacco. And like I say, if you look at over the last 20 years, there's been loads of kind of legislative things that have come in, ban on smoking in public places, ban on advertising, ban on point of sale displays, the variety of things. And what you've seen smoking prevalence in 11 to 15-year-olds drop from 19% down to under 5%. Now, that's not because of education, information, that's because the world around them changed. And, so that's what we need to make sure that we focus on, is changing the world around them. There's a really interesting group of young people called Bite Back. It's a national charity, and they train up local young people to kind of be activists in this space. So when I've gone and talked at Parliament, I've been sat alongside a young person who said, I was walking my brother to school this morning, and as I got closer to the school, I was told that it was 600 metres before this particular unhealthy food place, and then it was 400 metres, and then it was 200 metres, and it was there. And they talked about the fact that on the way to school, all of these exposures are happening for their brother, and they're asking us as adults to think about how we protect them. So I think there's a bit of a space around that, because it's only when people realise how they've been manipulated, I think, that they start to think, oh, this isn't right, and actually I want protecting from this. And that's what we saw with tobacco, and that's what we need to see here. There is also, there is a space and a place for learning to cook and learning about healthy. You do need that. It's not that it's not a thing. It's just that the industry want us to only focus on individual stuff, where we're teaching people to do as if it's the individual's fault, because it detracts from the bigger things that will make the greatest difference. So I'm definitely not saying don't do any of that. I'm just saying we need to make sure that we focus on, you know, those bigger bits as well.
Great. I think it's kind of a linked question. How do you reach communities who maybe don't have English as a first language? Are they more isolated from getting public health messages? And I'm thinking, especially in contrast, if you look at what the branding is for unhealthy food, you almost, that doesn't matter what your language is, you're going to be able to see that. So is there a challenge in getting
Yeah.
the right information to those communities?
Yeah, and that's why one of the recommendations was around making sure that our food offer is culturally sensitive as well. And this again goes back to how we work with our community voluntary sector partners. We're often not the best place as the council to be able to reach groups of people. And we saw this during the pandemic in a different way when we were trying to talk to different groups about the vaccine, for example. We worked with community leaders so that we could actually have the conversation, so that it was almost then that peer conversation. And so that's the way that we operate, you know, but there is probably much more we do. And as we see our cities diversifying even more, like especially our children and young people's age group, you know, and actually so there is much more focus that we need to put on that, ensuring, for example, there was a food bank that was set up in Gateshead. It was an independent food bank rather than the Trussell Trust one, but it was set up by a local community because they were responding to the issues in that community of refugees and asylum seekers who actually cook with different products, you know, maybe rice and so what they were doing was they were making sure that those sorts of food were available, because obviously that's where, you know, those communities have learned to cook as well. And then, you know, they were there, and actually the community themselves took over and run that now a few years on. But there's definitely more we need to do in terms of being culturally sensitive and culturally appropriate with our food offer.
I think you've got the advantage there as well of young people, if they're learning things in school, that they're also that route back to their families as well, that they can kind of take in those
test of power.
But yeah, I love the idea of Bike Back. I've had a question saying, how about we can get some speakers from them coming to schools here, which does sound like a brilliant idea.
I love that. So I was trying to get them into Gateshead College recently as well, because they're across the whole country as well. So you'll find that there'll be young people from Northumberland that are part of the Bike Back campaign, if you like, as there are in Newcastle and Gateshead as well. So yeah, it is definitely worth hearing from them.
So I've got a few questions that are kind of maybe more broadly public health than specifically the food issue. So a couple that are around, and David said they are somewhat rhetorical questions, but around if you can foresee there being control of lobbying at that Westminster level, because those lobbyists have so much to answer for in terms of tobacco, alcohol, sugar, fossil fuels. And then a question around whether the fast food outlets is there any challenging around false advertising, because, you know, you're calling something a happy meal, but actually long-term impact of that on health. And then also a question around whether there's public health advice is needed about microplastics. So
the first one is the Tobacco Convention, the International Convention for Tobacco Control that came in restricted tobacco industries from being able to lobby government in terms of policies. And that's when we started to see changes. So I always say we need to have exactly the same thing for ultra processed food, for alcohol, so that because it's not that they're not, you know, I'm not saying that they don't have some place in the world, or, you know, but what I'm saying is that we need to rebalance the fact that we need to protect our communities from this, because all of these products have become so normalized, and they haven't become normalized because people naturally gravitate towards them. They've become normalized because of the work that they're doing. So wherever I get the chance, I say that the Tobacco Convention, that we need something similar for the other products. I genuinely think it's really, like, if you look at the alcohol issue for the 10-year plan, it's really shocking to think that an industry that causes so much harm, evidence to cause 7 types of cancer, 1 in 10 breast cancers in women is caused by alcohol consumption. Yet they were able to influence a health policy that was looking at how we move from treatment to prevention. You know, so the irony of it is just, you know, but I think we just need to keep exposing it and keep calling it out. One of the things that we often get challenged with is, are we anti-business? And we're not anti-business. You know, that's the thing. I'm anti-unhealthy commodity industry in the way that they operate, you know, but I'm not anti-business, because we know that the economy is incredibly important. But actually, if you look at the harm that's caused by unhealthy food, alcohol, it's costing our economy dearly, but we just don't seem to have that sort of messaging balanced. In relation to the public health advice needed in microplastics, I see environmental health and environmental sustainability rather as part of the public health journey, and certainly the Marmot approach that we've adopted in Newcastle and in Gateshead used to have 6 policy objectives that were first introduced in 2010, and during the pandemic he added a further 2 because he recognised that they needed pulling out. One was around tackling racism, discrimination in all its forms, and one is around pursuing environmental sustainability as part of health equity. So we work very closely with the sustainability team in the council. We're doing a sustainability needs assessment in the city at the moment, and we're calling it sustainability and not net zero for obvious reasons. But there's a whole bit around actually how do we make sure that there's 2 sides of the same coin? Because if you have the environmental impacts that we're seeing in terms of global warming have a massive impact again on our most disadvantaged communities who don't have the resources to respond to it. That our poorest communities are more likely to be exposed to unhealthy air quality. They're more likely to be, there's a whole range of issues. So we can't tackle health inequalities without tackling environmental sustainability alongside it. So I, absolutely think that is an important point. And then the Happy Meal point, is that we do challenge advertising where there's advertising rules, I forget what they're called now. And I remember the one that we most recently challenged because there was a woman who'd just given birth and somebody had brought her a McDonald's in, and it was advertising, and it was in bus stops across the northeast. It was just horrendous. And we did challenge where we can, but we often, again, at David and Goliath, we don't necessarily have it. We can, the sort of resources and the ability to be able to tackle it. But definitely, it is something that we look at. And I think the issue that we do is we just need to start thinking about banning that type of advertising on our land, on land that is owned by the mayor, and actually that will start to influence. We've also seen, just from an inequalities perspective, that companies target unhealthy commodity advertising into our most disadvantaged places. So there was a particular study that looked at, it was Scottish school children living in the most disadvantaged wards were much more likely to be exposed to this advertising than those living in more affluent places and spaces.
It's also that it's quite often advertised in public transport, isn't it? So if your children are getting public buses and trains and metro to school, that's where a lot of that advertising is happening.
Yes.
I think we're coming up to 12 o'clock. So I think there's a question from Elizabeth saying again about Bite Back, how brilliant that is and how important that healthy school food is to food culture, that Wales has an excellent programme for getting veg into schools and organic farmers. I think there was a really interesting, on the food programme on Radio 4, they did a investigation into that. So I don't know whether that's something, it seems like there's been quite a lot of interest in food and farming and organic and sustainability that we can maybe look at for future debates. There seems to be interest for that. And then final question from David. So if mayoral means anything, can we get the majority of our MPs to lobby against the food lobby? So is that something that are there kind of groups within the political parties that have that as a focus? I know you're not political in that way, but is that something you're aware of?
I think you can ask your MPs. They represent you. They're elected because you've elected them. So I genuinely think there's much more scope for us to talk to our MPs around what it is that we want them to do. And certainly I'm able to have the conversations with the MPs I have contact with. So the people I've worked with, Liz Twist, who's one of the Gateshead MPs that I probably know best. She's always up for having conversations around what more, and I always send them my annual reports. And when I was in Parliament the other week, I met her for a coffee afterwards. They're really open to hearing, sort of the things that matter to local communities. But it is so important that you have a voice in that space. I know you know that, and I think the other thing is, Grace, you were talking about the organisation that you work for, making sure that people who are maybe less likely to be heard also have a voice in that space through you, if necessary, I think is really important as well. So again, trying to think about, like I say, inequalities are bad for everybody. Like, it doesn't matter if you're the richest person in the world, if you're having to put barbed wire around your house and carry a gun when you go to bed, that isn't a great place to be living in. So I genuinely think that people need to understand more about actually we close the gap on inequalities, which does mean, well, resources that are tight, we need to use them in different ways in different places to make sure we meet the needs of those who need us most. But advocating for that and your voices really matter.
Yeah, I think that's a great point to sort of end on, that there is so much that can be done in communities, and that it is people who are the most vulnerable, whether that's because of age or rurality, that people aren't able to access healthy food, if people are disabled, that whether they don't have as much choice over what they're getting, if they're in supported living or care homes or in hospitals, that there's those perhaps are the groups that need even more advocacy to be able to access that.
Yeah.
So yeah, thank you. That was really, really interesting, and yeah, so many things to kind of tangents to go off on
Yeah.
and look at. So thank you so much again for
You're
coming
very welcome.
and talking to us.
Maybe see you
Um,
next year.
yes, so yeah, next time you've done your report, we'll get you back. And our next debate is going to be April the 18th, which is going to be Maeve Cohen talking about new economics. So the details of that will be sent around, and you will be able to see this recording up on Hexham TV once that's all been processed. So thank you again, Alice, and thank you everyone for coming along, and we will see you next time.